Hello, I'm Nasrin Sultana from Bangladesh. I'm 38 years. I come here for the treatment of my neck problem.
Yeah, hi. I'm Sadaqe from Bangladesh, and she's my wife, Nasrin Sultana, 38 years old. She's suffering from the thyroid issues and the neck issues. Did some tests in Bangladesh and checked with the doctor, but you got two different reports from two labs. That's why we decided not to do treatment in Bangladesh. We decided to go abroad. But finally, I decided to do the treatment in India, and I checked with Yashoda Hospitals through the websites. And there is one Miss Chagarika from the marketing. She found out the best doctor, Mr. Dayakar Rao. And finally, we came Hyderabad and met with Dr. Dayakar Rao. And he checked all the reports and advised to do some more reports to reconfirm the issue. After test, he confirmed she need to remove the thyroid because of tumor and some other issues. And finally he did. I really appreciate the Dr. Dayakar Rao, the way he treat the patient, motivate the patient is really appreciable. And he really take care of the patient very good. And we are happy with his treatment. And the nursing of Yashoda also very good. All other services are very good. All of course helped me a lot in every single point. These are really appreciable. So finally, yes, I'm happy with all the service.
I am Dr. G. Dayakar Rao. I am a surgical oncologist. I am working in Yashoda Hospital Malakpet branch. So regarding this particular patient who has come all the way from Bangladesh to us for the treatment purpose, she came to us with swelling in the left side of the neck just above the collarbone. It was a huge swelling, around 18 to 8 centimeter swelling, which was fixed to the underlying structures. And on further examination, she was having a small nodule in the right lobe of the thyroid, and also there was one more nodule in the left lobe of the thyroid. So we suspected malignancy probably arising from the thyroid. So we evaluated further. So on clinical examination, she was not having any particular pressure symptoms like dysphagia or hoarseness of voice or any pressure symptoms. So we have done a FNAC from the thyroid as well as the neck node. FNAC from the thyroid, neck, both were suggestive of papillary thyroid. So we did a CECT neck to look for any other important structure involvement. So in the CT, the left side, the neck node was so big and it was completely not encasing exactly, but it was completely collapsing the right IJV. The plane with the carotid artery was bit maintained, but the IJV was indistinct. So we explained about everything, and we took her for surgery after anesthesia evaluation. Involvement of the left-sided IJV. So we were prepared for that. Our plan was to remove if the IJV was involved. So we have did the surgery with the routine incision, and we have done the neck dissection first. So in the neck, the lesion was involving the right IJV. The carotid was preserved, carotid vessel was preserved, and also it was stuck to some part of the sternocleidomastoid also. So the dissection was a bit difficult. We have to cut the sternocleidomastoid. Part of the sternocleidomastoid was cut, and also we have to sacrifice the left IJV because it was almost completely adherent to the IJV. Then the carotid was bit free. So after the dissection, very careful dissection, the carotid made free and the carotid was preserved. And also other important structure which we preserve is the spinal accessory nerve. So both spinal accessory nerve and the carotid artery was preserved, and the IJV and part of the sternocleidomastoid was excised. First we have done the left-sided neck dissection level 2 to level 5. Then we went to the thyroid. So both the thyroids were having a small nodules. They were not that big as lymph node. So both the thyroid, both the right and left lobe of the thyroids were removed. After that, we have done the central compartment dissection also, because she was already having the node in the left side of the neck. So we inspected the central compartment and we have done the dissection in the central compartment also. Then the right side, as a prophylactic measure, we have removed and 2, 3, 4 lymph nodes from the right side of the neck. So procedure was uneventful, though it was difficult, it was uneventful. After the hemostasis, everything was secured, we closed it. And post-operatively, post-thyroidectomy, major concern was voice. The other concern was the tracheostomy. Some patients will require tracheostomy. Tracheostomy meaning the hole in the trachea. So we were concerned about it, and we explained everything about the patient before also, and patient relatives also. So she was not requiring all those tracheostomy, and her voice was also very clean. So she was kept in the ICU for 1 day. After everything is settled, then she was shifted to the ward. She was there in the ward for almost 4-5 days, and her calcium was also normal in the examination, and she was discharged on day 4. So she came for the follow-up and she is fine. So basically, the thyroid surgeries, thyroid malignancies will have a very, very good prognosis, provided if they don't have any adjacent structure involvement. So especially this lady have a papillary CA thyroid, and we have done the R0 resection. Now right now we are waiting for the HPR report. Based on the HPR report, she might require radioactive iodine treatment. It is neither chemotherapy nor radiotherapy, but it is just one tablet she has to take. For the tablet also she has to get admitted. It can be given for 2-3 times, or sometimes in some patients it can be given only once. So generally these kind of surgery plus radioactive iodine therapy, generally it cures the disease. So we have to see, we have to regularly follow her up 3 to 4 monthly. Then we will see how she does in the future. Thank you very much.